Sherry Codron is leaving Hay River, Northwest Territories and traveling over 6,000 kilometers to Nicaragua for medical treatment. Living with chronic pain and mobility issues for over 3 years, she's willing to pay out of pocket in hopes of a diagnosis.
Back to November again, seeing Hay River Hospital, lower back pain, 4 to 5 days.
In 2021, she began experiencing problems with her knee, but her condition worsened while waiting for specialists and testing. In February 2023, she wound up in the emergency room in Yellowknife.
The doctors in the ER wanted me to see, they consulted with a neurologist in Edmonton, who wanted me to see that neurologist. And so the neurologist phoned me as soon as I got back to Hay River, phoned me, bam, and it's like, you're in. And I'm like, yay! It's like home medical travel. They wouldn't approve it.
Someone in the territory's medical travel bureaucracy gave Sherry the thumbs down. The referral wasn't issued by a physician in the NWT, so it couldn't be covered under the territorial policy.
And she's like, no, you have to wait for the neurologist to come, that we have one that comes up to the territories. I could not feel my legs from the waist down.
Politicians routinely acknowledge policy and process barriers that hinder patient experience and outcomes when they have to travel for medical care. There's strict rules on who and when someone can travel with an escort, modest per diem rates, confusion over referrals, and what patients will be on the hook for financially. Even a life-threatening incident like a stroke might result in the patient and their escort being shouldered with travel costs. On July 3rd, the Standing Committee on Social Development spoke about these gaps.
Like, how do we help these people? Because it comes off as arbitrary at the end of the day when you have your doctor, your nurse, all these people pulling for you and saying, we're trying to help, we're saying this person needs to be here, and we're advocating to the medical travel coordination unit of the department to get the exemption for you. And then the administration comes back and says, no, we're not going to do it.
It's a complex, costly system. Some folks have employer-sponsored plans with GNWT and feds. There's private third-party insurance and Workers' Safety and Compensation Commission, and non-insured health benefits.
Healthcare system, okay. And for the rest of the other population with no insurance, okay, they're the ones that are losing out a lot in this whole process, especially with the medical travel.
And demand is increasing, with nearly 17,500 total cases of medical travel between 2022 and 2023 fiscal year. A quarter of those cases had to fly out of territory. These 2 Yellowknife boarding homes are at capacity and often put people up in hotels. Codron finally saw a neurologist in Yellowknife in June 2023, but says she was told she needed to get used to walking with a cane for life.
And how many times I've been to emergency, how many times I've been, I can't even say medevaced out, they just throw me on a plane. Yeah. But I can't imagine the costs. And so Treaty's getting billed for this, I'm assuming. But yet Treaty has no control over it.
APTN repeatedly asked for interviews with the health department to discuss medical travel, but were denied. With medical records in hand, Codron has lawyered up for what she considers negligent treatment. In the meantime, she'll seek help elsewhere.
My biggest fear is they'll misdiagnose me. My biggest fear is getting treated here. That's why I'm going someplace else.
Charlotte Moore Jacobs, APTN National News, Yellowknife.